It is true that some people may have warning signs of a stroke a month before it happens. But this does not mean that you have a month to see a doctor. If you experience any symptoms of a stroke, you need to seek medical attention right away, even if you think it will happen a month later. If you delay, you could die or suffer permanent damage within hours, days, or weeks, instead of a month later. One of the main challenges of preventing a stroke is that it can happen with or without warning signs. Some people may experience a transient ischemic attack, which causes stroke-like symptoms. However, relying only on symptoms cannot distinguish between transient ischemic attack and stroke. Moreover, a transient ischemic attack does not necessarily indicate whether a stroke will occur. For example, a week or a month before a stroke, as it can happen at any time. Transient ischemic attacks are often called mini-strokes or warning strokes. According to the American Stroke Association, a transient ischemic attack is a warning sign that a more serious stroke may happen soon. In fact, up to 20% of people who have a transient ischemic attack will suffer a full-blown stroke within the next 90 days. With the highest risk in the first week, and half of those strokes happen within the first 2 days. A stroke occurs when something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. To work properly, your brain needs oxygen. Your arteries deliver oxygen-rich blood to all parts of your brain. If something happens to block the flow of blood, brain cells start to die within minutes. There are 2 types of stroke. Ischemic stroke. Most strokes are ischemic strokes, which occurs when blood clots block the blood vessels to the brain. Hemorrhagic stroke. A hemorrhagic stroke happens when an artery in the brain leaks blood or ruptures. High blood pressure and aneurysms, balloon-like bulges in an artery that can stretch and burst, which can cause a hemorrhagic stroke. The difference between a transient ischemic attack and a stroke is that a transient ischemic attack is a temporary disruption of blood flow to the brain that does not cause permanent brain damage, while a stroke is a more severe disruption of blood flow to the brain that can cause permanent brain damage or death. Some major risk factors for a transient ischemic attack or stroke are high blood pressure. This is the most critical risk factor for transient ischemic attack and stroke. It causes damage to the arteries over time, making them more likely to burst or clog. Therefore, it is important to control your blood pressure and prevent stroke. High cholesterol. It can build up in the arteries and block the blood flow to the brain. Eating healthy foods, regular physical activity can help you stay at a healthy weight and lower your cholesterol. Heart disease. In 2021, 1 in 6 deaths from cardiovascular disease was due to stroke. Heart disease can damage the arteries that supply blood to the brain, making them more prone to narrowing or rupture. This can lead to ischemic stroke when a clot blocks an artery, or hemorrhagic stroke when a blood vessel bursts. Heart disease can also cause irregular heartbeats, such as atrial fibrillation, which can make the blood pool and clot in the heart chambers. These clots can then travel to the brain and cause an ischemic stroke. Diabetes. When glucose builds up in the blood, it can damage the blood vessels over time, which can prevent oxygen from getting to the brain and also increase the risk of high blood pressure and high cholesterol. A history of stroke. Having experienced a stroke before raises the risk of having a stroke. Nearly 1 in 4 are in people who have had a previous stroke. A transient ischemic attack can cause the same symptoms as a stroke, such as weakness, numbness, vision problems, speech difficulties, and dizziness. However, unlike a stroke, a transient ischemic attack does not cause permanent brain damage, and the symptoms usually go away within 24 hours. It is crucial to act fast. If you or someone around you experiences clear warning signs of a transient ischemic attack or a stroke. FAST is an acronym that stands for face drooping. Ask the person to smile and see if one side of the face is drooping or uneven. Arm weakness. Ask the person to raise both arms and see if one arm drifts downward or is unable to move. Speech difficulty. Ask the person to repeat a simple sentence and see if the speech is slurred, garbled, or hard to understand. Time to call 911. If you notice any of these symptoms, even if they go away, remember, a transient ischemic attack is a wake-up call that your brain is not getting enough blood and oxygen. It is also an opportunity to take steps to lower your risk of having a stroke in the future. By calling 911, you can get the person the urgent medical attention they need to prevent a stroke or minimize its damage.